Welcome to the Health and Wealth Using Data to Address Income Inequality webinar. The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. This program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. My name is Carla Freeman, and I'm an action learning coach with County Health Rankings and Roadmaps based in Roswell, Georgia. We have a great team today, so let me take a moment to introduce the facilitators and guests for today's webinar. We're going to stop sharing slides for a moment and share our videos. Today, I'm joined by my colleague, Lindsay Garber, a network strategist for County Health Rankings. Hi, Lindsay.
Hi, Carla. Hi, everyone. I'll be manning the Q&A chat box, so if you have any questions, send them in, and we will get to as many as we can.
Thank you. I also want to introduce you to other colleagues who will be joining us today. Raquel Bornanes, who will be chatting with you in the chat box. Hi, Raquel.
Hi, everyone. I'm going to be engaging with you over the chat today. And just remember that you have to use the drop-down box and select all panelists and all attendees so that everyone can see your chat. Thanks.
And our technologist, James Lloyd, who will take care of any technology snafus. You can chat to James if needed. Hi, James.
Hi, Carla. Yeah, just instant message me in the chat and let me know if you're having any particular difficulties.
And most importantly, we're also delighted to be joined by our partners on this webinar from Prosperity Now. LeBaron Sims is a Senior Research Manager in Applied Research, and Parker Cohen, Director of Savings and Financial Capability. Hi, LeBaron. Hi, Parker.
Good afternoon, everybody.
Hi, thank you for having us.
Great. I invite you to join us after the webinar to dig a little deeper into today's topic. Immediately following this webinar, we will offer an interactive discussion group to exchange thoughts about how strategies related to today's topic may work in your communities. These conversations give you the chance to be face-to-face with other webinar attendees and share what you are doing locally, as well as ask questions of other participants. We are pleased to be able to offer these sessions in partnership with Healthy Places by Design. Joanne Lee with Healthy Places by Design will be our lead facilitator. Watch the chat for details about how to connect later in the webinar. We'll be sending that information as we approach the closing of the webinar. We have several outcomes for the webinar today. We would like to make sure you understand what resources and data are available from both County Health Rankings and Roadmaps and Prosperity Now, and how to utilize both sources to address local issues. So let's start with the why. Why does County Health Rankings and Roadmaps exist? County Health Rankings and Roadmaps has two primary overarching goals. The first is to improve health outcomes for all. This includes both how long people live and how healthy they are. The second goal is to close the health gaps between those with the most and least opportunities for good health, thereby advancing health equity, a focus of today's webinar. So let's start with the model that underlies the work of the rankings. One of the goals we've had with this image is to help change the conversation about health and what influences health. What this image shows us is that health is more than what happens at the doctor's office. A wide range of factors influence how long and how well we live. It includes things we often think about when we hear the word health, like health care and how well we eat and how much we move. But we know it's also things like education and income, the quality of our housing, and the safety of our neighborhoods that have the greatest impact on health. Starting from the bottom, we know from the research that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors in the blue boxes shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes, those are in the green boxes, to show how healthy each county is: the length of life and the quality of life. Social and economic factors make up 40% of a community's rank, a significant portion of the health of a community. Our guests from Prosperity Now will focus on the economic factors that influence health. We're excited to have them join us to talk about how they use data to highlight community strengths and challenges surrounding income inequality, financial stability, and health.
Great. Thank you so much, Carla. This is Parker Cohen from Prosperity Now. So Prosperity Now's mission is to ensure that everyone in our country has a clear path to financial stability, wealth, and prosperity. We carry out this mission through a number of avenues. We work with programs on the ground that support building financial stability and security, including through a team that focuses on exclusively bridging the racial wealth divide. We also conduct research on the financial lives of low to moderate income households and support policy advocacy, at the local, state, and federal levels for policies that can change the context and make it easier for households to build wealth. Finally, we curate and analyze data on financial policies and outcomes, and this informs all of our work and drives understanding also across the country. We do this via our Prosperity Now scorecard. And I'm going to turn it over to LeBaron, who leads this initiative, to tell us more about it.
Thanks, Parker. Good afternoon, everybody. I'm LeBaron Sims, the Senior Research Manager at Prosperity Now. And I'm here to talk a little bit about our Prosperity Now scorecard tool and where there's overlap between our work and the work that we do within our organizational community partners and the work of county health rankings and roadmaps. So to start, our Prosperity Now scorecard tool draws on wide-ranging data sources to illustrate the economic well-being of U.S. households and communities across all 50 states, including the District of Columbia and Puerto Rico. The scorecard connects seemingly disparate fields from the national to the local, from policy to practice, across communities all over the nation. And Prosperity Now has been focused on savings as an asset building strategy over the past several years, but the scorecard has never wavered from its very broad and holistic view of what it takes to build healthy communities. And through national narratives and community profiles, like those you see on your screen, the scorecard clearly communicates why data and policy matter, and it exhorts its users to take action because data and numbers only really matter if you can connect them to the real people that underlie those numbers and to ways to help them improve their lives. Next slide, please. The scorecard is designed to meet the needs of data advocates who are looking for trend analysis, data tables, and national comparisons across geographic areas, including cities, counties, Native American tribal areas, and congressional districts. And you can access these comparisons by visiting scorecard.prosperitynow.org and by selecting our Data by Issue Area module, which you can see on the right side of your screen. Next slide. The scorecard is also designed for state and local program and policy advocates to access data for their areas of interest, their geographic areas of interest, their cities, counties, their states, their communities, and help them to create resources to share with the important people in their work. Our data by location module digs into thousands of geographies at a handful of levels nationwide And it offers area profiles, customizable graphics, maps, and charts for every data measure in our database. Next slide. And each of our local profiles interrogates the outcomes in health, in wealth, in employment, housing, education, lifestyle of U.S. households, U.S. families, and residents, 75 outcome measures total. And at every geographic level, we also include data disaggregated by race and ethnicity in 26 measures total. We also include 28 state-level policies identified and resourced by Prosperity Now state and local policy team. And those policies packaged together can help to move the needle on creating economic opportunity for your state's residents. And these policies overlap a great deal with, and in some cases actually draw on, the holistic, vetted, and approved policy measures advocated for through the County Health Rankings and Roadmaps website. And this includes the state EITC, minimum and living wage protections, paid sick leave and paid family leave, and universal pre-K, among over a dozen others. And by tracking such a broad array of policies, we hope to meet the needs of our very diverse field of partners and advocates. Next slide, please. Now, we work to address two primary challenges from across this, again, very broad field. First, local advocates are working tirelessly to build stronger communities, but they need more help taking coordinated and targeted action. And the Scorecard team helps them by providing sustained and proactive community engagement and skill building. Now, for example, our Racial Wealth Divide Initiative team and our Scorecard state and local policy team have been working with cities all across the country in helping to advocate for policies, statewide policies, that they'd like to see enacted that will impact the full population of their state. Most recently, we were working in Newark, New Jersey with the New Jersey Institute of Social Justice, or New Jersey Institute for Social Justice, excuse me. And their work on proposing and helping to enact a statewide individual development, or IDA account, to help expand financial security and help residents, especially children in the state of New Jersey, achieve significant financial goals like purchasing a home and paying for higher education. Another initiative that was being led by the New Jersey Institute for Social Justice is the Newark 2020 initiative, which is developed with the goal of decreasing the unemployment gap between the city of Newark and New Jersey overall. And in both cases, our work through the Racial Wealth Divide Initiative and with our Racial Wealth Divide local profile for the city of Newark was used to inform those policies and their local advocacy. Now, second, we also work with advocates who struggle to articulate and disseminate a cohesive and powerful message to their stakeholders and to policy leaders in their communities. And by strengthening our messaging tools, like our Scorecard racial disparity rankings, and by producing more deep dive community analyses, like the aforementioned Racial Wealth Divide Initiative profile for the city of Newark and for a handful of other cities across the country. The Scorecard team, our Racial Wealth Divide Initiative team, and Prosperity Now's programs teams elevate the solutions that are already being championed in communities across the country. And in doing so, we certainly hope to solidify the Scorecard's use as a foundational community engagement tool. Next slide. Now, this year, the Scorecard team is prioritizing real-time specialized analysis around household outcomes related to COVID-19, the economic shutdown, and some of the racial divide in outcomes that we see in cities across the country. We're also providing direct community engagement and profile design for, again, a handful of cities all across the country, and all with an explicit focus on the impact that race, policy, and history have on today's community outcomes, which we really do see today. Because the power of the Scorecard lies in clearly articulating the connections between the macro and the micro, and in communicating the impact that forces like policy have on the lived experiences and outcomes of households and families as illustrated by our data. And by fostering increased representation through targeted coalition and skill building among our local partners, the Scorecard team can help those communities take action to fight back against some of those forces. And with that, I'll pass it back to my colleague Parker Cohen to discuss what we're doing with respect to health and wealth through our programs teams. Parker?
Thank you so much, LeBaron. So LeBaron did a fantastic job of showing how these critical data can tell a story and drive actions. And just as Carla showed how many social determinants shape our health outcomes, the scorecard that LeBaron just showed highlights data in 5 areas: financial assets and incomes, businesses and jobs, home ownership and housing, healthcare and education. And all of these areas have an impact on financial outcomes for individuals, households, and communities. So we can see how, it's clear, just from these slides that health and wealth share overlapping determinants. We're talking about the same things that shape health, also shape wealth. And because of these unique intersections, we have launched the Health and Wealth Network, a hub that will build a national community of stakeholders working towards shared goals at the intersections of health and financial well-being. So the purpose of this network broadly is to build a cross-sector understanding and collaboration across the intersections of health and wealth. Too often, stakeholders in whether it's the financial services field or the healthcare community or the public health community, we're working to solve problems that are rooted in the same forces, but we aren't speaking the same language. And we need to build up this shared understanding and increase collaborations. We're planning to, or we are exploring innovative practices and policies that enhance both health and wealth outcomes concurrently and address disparities in health and wealth as well. We do all of this through several activities, including webinars, blogs, videos, and other engagements. We also have been engaging an innovative group of medical financial partnerships. These medical financial partnerships are typically healthcare providers who have integrated financial capability or financial empowerment services into existing healthcare operations. So, for instance, a community health center might provide financial coaching or access to financial assistance. And these practitioners are working at the nexus of health and wealth and programmatically working on these issues together. So we're convening this group to really learn from their experiences, share promising models, and tackle challenges together. And so on the next slide, I want to talk a little bit about how we see the framework here. How do we see the relationships between health and financial insecurity? So, what we really see is, as Carla said earlier, socioeconomic status, financial security and income, et cetera, are social determinants of health. But that's absolutely right. And the converse is true as well. So we've long known how financial well-being impacts your health outcomes and also how your overall health and healthcare costs, of course, impact your financial well-being. And so in this vicious cycle between financial insecurity and health, we see this playing out as follows. Poverty and financial stress are both shaped by economic inequalities, particularly racial economic inequality. And these forces together have a strong impact on physical and mental health. They can lead to toxic stress, as well as risk for chronic disease and adverse mental health outcomes, such as depression. And at the same time, your health status and healthcare situations, of course, can lead to financial insecurity. We all know from our own lives how this can happen. The cost of emergency care, such as from, say, a broken arm, can lead to a financial emergency or medical debt that's really hard to dig out of. And relatedly, managing chronic conditions can cause ongoing expenses that inhibit financial security or may even reduce earnings potential over time. So not only is financial well-being a determinant of health, health and healthcare are a determinant of financial well-being. And there are many more connections that form this cycle that we could touch on. And note that this is not intended to show all of the effects and all of the interactions. There are many, notably racism and discrimination is not called out explicitly on this slide, but plays a critical role in these interactions. But really, this is intended to offer a framework for us to understand how health and wealth interact. And many factors, such as other social determinants of health, are incorporated in this feedback loop, but are not listed. So on the next slide, I want to talk a little bit about how we see this relationship between financial insecurity and physical and mental health playing out in the COVID-19 crisis. We're currently witnessing a new manifestation of these intersections in this relationship, where the existing dynamic of economic inequality, particularly racial economic inequality, influencing poor health outcomes, is playing out tragically as already financially vulnerable populations are bearing an increased disease and death burden. They are more likely to work in unsafe conditions, have less access to essential health supports like sick leave and health insurance, and for people of color face discrimination in care. And these all lead to adverse health outcomes, which sadly and tragically, the data is bearing out every day. Also, of course, this health crisis has led to financial vulnerability for a large portion of the population. LeBaron recently wrote a critical report about the impacts of the financial or the impacts on financial stability for different populations across the country, and how this crisis is affecting so many who are already vulnerable. And this financial vulnerability is having a cascading effect as the critical social determinant of health of financial stability that you get from income and employment was removed or disrupted for so many, which is leading to additional cascading effects on many other social determinants of health, such as housing and food security. So, just wrapping up my overview here of how the Health and Wealth Network really views these relationships. I want to say that we heard earlier from LeBaron about financial outcomes and data, and now I'm going to turn it over to Carla to discuss how the county health rankings can support our understanding of health outcomes in communities across the country.
Thanks, Parker and LeBaron, for sharing more about Prosperity Now's work and your Scorecard resource. I want to turn now to county health rankings and roadmaps to share some of our resources and highlight ways that these can be layered with Prosperity Nows to help you create a more detailed picture of the health of your community and take action to address economic inequality. This is a screenshot of our website, countyhealthrankings.org. Here you can address the menu of data and resources. On our homepage, you can click on your state or type in your county to access your local data. And when you do, you will see a snapshot of your county. On your county snapshot, you'll see lots of data. To start, take a look at the big picture, your health outcome and health factor ranks. These are in the right column. For example, here you'll see this county is ranked 47 in this state for social and economic factors. Health outcomes help us understand how long and how well people are living today, and health factors look at a range of different factors that can be indicators for how healthy our county might be. Look at the health factors. These include health behaviors, things like smoking rates, how much we move, diet, clinical care, whether we have access to doctors, the physical environment, things like air and water quality, the availability of safe and affordable housing, and social and economic factors, which Prosperity Now has already talked about quite a bit. In many cases, the measures we use and those of Prosperity Now overlap, while each of our organizations provides other unique measures too. Finally, we encourage you to explore some of those measures to get a sense of your community's health and well-being. To do this, you may want to use our areas to explore and areas of strength feature. If you select areas to explore and areas of strength, you'll see highlighted measures that are particularly worrisome or particularly great when compared to the state or national averages. These comparisons don't replace a true priority setting process, but they can give you a quick peek into strong and weak areas in your county that might be worth exploring further. Within counties, differences can also exist from one neighborhood or zip code to the next, or among different racial and ethnic groups. For some measures, we include data disaggregation by race and ethnicity. Any measures with the value that appears in blue and underlined, like children in poverty in this image you're seeing now, for others, County Health Rankings data doesn't capture these differences. Prosperity Now also offers data on smaller geographic areas and different subgroups. Don't forget to check out their scorecard to see if the data you're looking for might be available there. When you're ready to decide on a strategy, we invite you to explore what works for health section. This tool is also available under the Take Action to Improve Health section of our website. At its core, What Works for Health is a tool to help communities make decisions about the strategies they can use to address local health priorities and do so without reinventing the wheel each time. It really makes harnessing evidence easier for communities. You may explore more than 400 evidence-informed strategies by topic or using a keyword search. Each offers additional filtering options to further refine your results. You'll find dozens of programs and policies to consider to address key social and economic factors. What Works for Health provides information about what works, what might work, and what does not work. You should connect the evidence available with your local culture and context to ensure you find a strategy that will work for your community. Here, you'll see an example of what a strategy looks like on the website. This is an abbreviated version of our paid family leave entry, meant to provide a quick glimpse of what all of the elements we've outlined look like when they come together to form a strategy. This is also a policy that Prosperity Now includes in their scorecard. On each strategy's page, we include the title and a temperature gauge illustrating the evidence rating. The completely green filled gauge indicates that this strategy is rated scientifically supported, which is our strongest evidence rating. You can learn more about our evidence ratings by clicking on the blue information icon here. You'll see icons like this throughout the site. Please click them to learn more. Turning back to the strategy, we include a description at the top and then move down through the expected beneficial outcomes, and here have space for just a snippet of the evidence of effectiveness section, which is our literature summary. Moving to the next panel, you'll see our assessment of the impact on disparities, which communities indicate they especially appreciate, as well as implementation examples and resources. These can help you learn about other communities or organizations that have implemented this strategy and any resources that can help your community hit the ground running. Now that you're familiar with the data, tools, and resources that Prosperity Now and County Health Rankings have, we encourage you to think about ways that you could bridge these two resources or use them together as you work to address economic inequality and financial instability in your community. For example, you could bridge the data resources by pairing Prosperity Now scorecard data and local profiles for your community with County Health Rankings data for your county to get a broader picture of health, including both the social and economic factors and healthcare, health behaviors, and other indicators. Understanding the bigger picture can be a vital step to creating sustainable systems change. County Health Rankings and Roadmaps also has great resources to help you improve your data fluency and explore ways to better understand and use data to improve health. Our action learning guides are self-paced and interactive resources that blend guides, tools, and activities to help you deepen your learning on specific topics. They're designed to be used independently or with members of a group to collaboratively discuss the topic. You can also use County Health Rankings and Roadmaps and Prosperity Now's policy resources together. Find out what's been implemented in your state through Prosperity Now's scorecard and the policy briefs seen here. See something from Prosperity Now's scorecard that your state and county hasn't enacted? Check out What Works for Health to find out more information about it. Remember, What Works for Health includes evidence ratings, information on the impact on disparities, as well as implementation examples and resources to help you identify the right strategy for your city, county, or state and get started. While Prosperity Now and County Health Rankings include many of the same policies, you can find unique strategies within each program. As Parker mentioned earlier, when discussing the Health and Wealth Network, finding the right partners across sectors is vital to make big systems level change. There are ways you could layer the partnership resources available through both of our programs to enhance your collaborative work. From Prosperity Now, consider looking at their Community Champions map to find organizations and potential partners working directly in your state. You might also consider signing up to participate in some of their engagements with the Health Wealth Network to connect with others working at this intersection. From County Health Rankings, take a look at our Partner Center. The Partner Center, which you can also find under Take Action to Improve Health on our website, is all about joining with others to make lasting change in your community. It answers the question, who should we work with? Think about the people in your community who make positive changes happen. We call them leaders, change makers, or stakeholders. Whatever you call them, these are the people you want to partner with. How do you reach them? You start by doing some research to find out what their goals are and how they might align with yours. Think about what's in it for them and find a way to get connected and begin to cultivate a relationship. The Partner Center can help you get started. It provides guidance around why different sectors might care about creating a healthy community, what they can do, and how you can engage them. Both County Health Rankings and Roadmaps and Prosperity Now also include a suite of action tools that can be used together to make change locally. County Health Rankings Action Center, which is also under the Take Action to Improve Health section of our website, provides step-by-step guidance and tools to help you move with data to action. The Action Center answers the question, how can we take action? Each action step is broken down into key activities with guidance and suggested tools to support your work, from assessing your community's needs through evaluating your work. I also want to note our Communicate tools. As LeBaron mentioned earlier, one of the challenges that many organizations and communities face is defining and disseminating a unified message to their stakeholders. Our Communicate guide can be an invaluable resource that, combined with solid data available from both organizations, can bolster your message with stakeholders and decision makers. Prosperity Now's suite of action tools can help you move with data to action through online learning opportunities, capacity building, engaging in advocacy work, and connecting with others addressing similar challenges through their networks. We hope you've learned a bit more about how County Health Rankings and Roadmaps and Prosperity Now can be a resource as you navigate community change. We invite you to reach out if you have more questions using the Contact Us button on the website. You'll receive a copy of the webinar recording as well as a resource guide from the presentations today. I'm going to pass it over to Lindsay to see what questions we have that have come into our Q&A box. Hi, Lindsay. You're on mute, I think.
Thank
There
you.
we go.
Hi, everybody. We've gotten a few great questions, and I encourage you, if you have more, pop them in the Q&A, and I will try to read them as we go through the ones that have already come in. So feel free to add some more. So the first question that's come in from a few folks are, do you have any resources or guidance on how to help interpret data to local contexts? I will call our friends at Prosperity Now back up to our virtual podium to start.
Sure, and I'll take that question. So the scorecard is designed to really make data interpretation and sharing as easy as possible for folks. Our state and local policy team and our field engagement teams actually have done a great job of providing resources, webinars, blog posts, and content around the best ways to talk about data for your community and communicate it not only through your own writing and resources, but communicate directly with stakeholders, with policymakers at the local level, at the state level, and honestly at the federal level. You know, every 2 years we host our annual conference, or biannual conference. It's not annual if it's every 2 years. Our biennial conference, the Prosperity Summit, which is scheduled for later this year, though we won't be having it in person this year. And we typically take folks from the field onto the Hill to talk about, to Capitol Hill in DC, to talk with their representatives and include profiles, graphics, resources from the scorecard as kind of a packet to share with your policymakers. So if you go to the Scorecard website, again, scorecard.prosperitynow.org, and visit the additional reports section, you can find our policy briefs, you can find our local policy guides as well, and some resources, writing, and a way that you can connect to all of our networks across the organization to learn more about what folks are doing in your community and what organizations are really putting in that work.
That's great. Thanks, LeBaron. I know for county health rankings, we've got a number of resources to really help you connect to the data. So one of them Carla already shared is our action learning guides. We have 3 in a series all about understanding data better, becoming more data fluent. And so these answer a lot of questions about sort of what does data tell us, what kinds of things are data, and even some guidance on how to collect local data that can really help you get a local context and get some community engagement and resident engagement so that you're getting real on the ground data. So that's one great resource. The other thing that I would say for the county health rankings data, if you go to your snapshot, you can click on any of the measure titles. So Carla talked about children in poverty earlier. You could click on children in poverty and you can explore quite a bit about that measure. So look at, what it actually means, what we're measuring, what our data source is. And then you can also find local data sources that might help you really get a sense of what's happening directly in your community. Say if you wanted at a smaller scale than county, or you wanted to look at, a different source in your state or county. So I encourage you to go to your snapshot and really look at, what the measures are measuring and some of the additional resources that our data team has put together to help you interpret what you're seeing on the screen. So I will jump right in. The next question we've heard from a few folks are looking for, again, additional resources and guidance on sharing data with decision makers or policy makers to support any initiatives or efforts that a community may be wanting to undertake. So I'll again, LeBaron and Parker, if you want to jump off.
Yeah, again, I'll take this question, and if Parker wants to add, I open the floor to him. But one resource that our state and local policy team has put together that is really valuable for folks who are working to push policy at the local level is our municipal policy blueprint. We also have a state policy blueprint that focuses exclusively on policies related to racial wealth equity. But the municipal policy blueprint goes through over a dozen policies that we think can help move the needle on local outcomes and economic disparities. And that one also provides some strategies and talking points for how to engage around some of those policies, or just generally policies at the local level with local policymakers, even if they're not necessarily included in our local policy blueprint. So again, if you visit our Scorecard website's additional reports section, which is scorecard.prosperitynow.org/additional reports, you can access the municipal policy blueprint and all of our other local policy resources. And if you also visit our custom report section in the Scorecard, That's where you can access all of our local graphics, our local profiles for every geography that we have available in the scorecard. That section will also connect you, those local profiles can also connect you to our broader Prosperity Now community of local advocates who are, again, hard at work in each of their communities across the country.
Great.
And I can jump in. We also have an action learning guide that looks at government agencies and policies. So we encourage you to look at that as well on countyhealthrankings.org website.
Yep, you can also, our partner center has some additional resources on connecting with government as well. So if you're, I know Carla explained that resource as well, but if you're looking at ways to engage government, that's another great place to look with County Health Rankings. One more question we've got, are some more examples of communities that are using data from either the scorecard or the County Health Ranking snapshots to influence and set local priorities? We'll stick with the old standard and go with LeBaron to start.
Yeah. Thanks for the question. It's a great one. So a lot of, if you actually go to our scorecard website, in the additional reports section, we also have some local data reports and profiles. And there you can actually access some of our state and local profiles, like the Newark profile that I mentioned earlier. Another profile that we did, we actually did a series of profiles in late 2018 in partnership with some local organizations in Dallas, Texas. One of those profiles was what we called our assets and opportunity profile, focused on, it was actually an update from a profile that we created back in 2013, again, in partnership with the city of Dallas, that actually ended up feeding into a series of city-level initiatives around financial inclusion. And the city contracted with us to update that profile because it had so many of the talking points that came from that profile ended up feeding into the city's work around helping to create new programs and initiatives citywide related to building financial inclusion for disinvested Dallas communities. And that one in particular, has had a pretty big effect on the area, on the city. We're actually working to update, once again, the data estimates, the racial wealth divide data estimates for the city of Dallas, and working to build and strengthen our relationships with community members in that city as well. I'd also point to our work with the Northwest Area Foundation through the African American Financial Capability Initiative, a mouthful, or the AAFCI. Our Racial Wealth Divide Initiative team, led by Kat Gognauer, who is one of the MVPs at the organization, has been doing dedicated work in the Twin Cities, in the Pacific Northwest, in Seattle, in Portland, in Tacoma, and working with local advocates there to build a strong policy advocacy agenda and build strong relationships with other local area advocates and programmatic partners throughout the city, and really help to build the resources and the technical capabilities and strengths of all of those local organizations, again, with the focus on the racial wealth divide. So as an organization, Prosperity Now is doing quite a bit on really every level. And all of these programmatic and policy efforts are informed by the data.
That's awesome. And I wanted to just point out, I don't know if Lindsay did or not already, but our action learning guides, we have an actual learning guide that looks at specifically at data and how to interpret data. So we just really encourage you to go there. And again, our partner center really looks at partnering with government agencies and deciding what your strategy can be to get your message across to them.
Yeah. So one of the communities that it was a Culture of Health Prize winner a few years ago is Santa Cruz County, California. And they have actually done a lot to use the data in their scorecards and snapshots to really set priorities. They noticed that obesity was incredibly high for their area and decided to create an ordinance. And they are working to create healthier stores and make sure that stores and restaurants are providing healthier options for residents. And they have a team of young people who go around and really work with those store owners to get a sense of what's available in the community. And so I think Raquel may be able to chat out the link, but you can find a short video in one of our action learning guides about the work that's going on in Santa Cruz to address what they found was really a specific issue in the data and how they're addressing it with policy and programs. So that's one great example. We had a few more questions pop up, and I want to make sure we have just another minute or two for questions. And so one of them is about the time when data are collected. And so the question is, what is the time period for collecting and posting data, especially now in the COVID era when things are changing so rapidly and folks are looking for real-time data? What's the time lag? So LeBaron, would you be able to comment on Prosperity Now's scorecard?
Sure. By and large, we use national data sources. Again, we'd like to normalize all of our data points across every geography in the scorecard. And with over 13,000 geographies in the scorecard, it kind of limits the amount of real-time data that we're able to access. So most of the data that is currently on the scorecard was collected in calendar year 2018 and released in calendar year 2019. There are a couple of exceptions. Thinking of like the unemployment rate, for example, which is the most recent year, 2019, but it's because the scorecard data was updated in January and is updated annually in January. That said, we've done this year a series of real-time data briefs and reports and analyses. Parker mentioned one earlier that discusses the unequal impact of COVID-19 on vulnerable households and populations across the country. We also released another one last month that related to the impact of COVID-19 on small and micro businesses across the country. And we're working currently on a forthcoming one that's going to dig into the outcomes of immigrants across the country. And so while we can't necessarily include at the moment real-time data that really digs into some of the impact of COVID-19 and the economic shutdown and the impact on America's communities, we are working on making sure that we are providing some data and analysis that does get at some of these real-time outcomes.
That's great. I'm really interested to see that when that comes out. For county health rankings, we're in a similar position where our rankings are released and updated once a year. And because they're at the national level, a lot of our data comes from national data sources. And a lot of the real-time data that I think is coming out with COVID tends to be more local, just because it's so hard to collect and clean and analyze data at a national level really quickly. So ours varies, the 2020 rankings vary from a year or two ago to over a few years. Some of our measures we also sort of average over a number of years to get a more accurate picture. So it's not real-time 2020 data. I think we don't know when 2020 data is going to come out. A lot of it doesn't come out right away. But it's always our goal to have the most up-to-date data that we trust, that we know is accurate, to make sure that when you're looking at your county health ranking snapshot and you're using it for a CHIP or a CHA or for setting local priorities, that you're getting accurate data. And that's really what our priority is. But you were absolutely right, with unemployment growing in 2020 and COVID greatly impacting sort of a number of factors. I think the data is going to be very interesting, but also pretty hard to come by really quickly.
Yeah, I would also just say that the Census Bureau is currently releasing their household pulse survey each week. which really digs into state-level outcomes, national outcomes, and outcomes for, I believe, the 15 largest metro areas across the country on a handful of questions that are directly related to the COVID-19 pandemic. So I'd highly recommend that you visit census.gov to learn more about that survey. And the Scorecard team is actually meeting later this week, or no, early next week, to talk about how we might be able to leverage some of that data in some of our tools. So keep posted.
That's great. And we have one last question. Someone says that they are overwhelmed with resources. I can believe it. We have thrown a lot of links and resources at you, and hopefully that's a good thing. And they're asking for a suggestion on one step to get started with either deciphering data or really making the data come to life. So LeBaron, if you had advice for getting started, what's one thing you would say?
Oh, you're asking the wrong person, honestly. I like to just dive in head first into the data. Honestly, I would say if you're starting with the scorecard, start with your state. Go to the data by location module, use the map. The mapping tool is interactive. You can click, things will light up. You can change the geographic level. You can change the measure that's displayed on the map. But if you just select a state, either using the interactive map or the search function that is above the map, you can access every single piece of data that's in the scorecard. You can create a PDF that prints out all of your state's scorecard data and your state's community champions. So our Prosperity Now's organizational partners, and every bit of and your state's relative rankings also. So how does your state stack up against the other 49 states in the District of Columbia? If you're going to the scorecard, I'd say that's your first bet. Or again, visiting our additional report section and really digging into some of the resources that our state and local policy team has put out that really synthesizes the data and gives you strategies on how to use the data in both programmatic work and policy work.
That's great. I can attest that the mapping feature on the Scorecard website is real fun to play with. So definitely go take a look. If you're looking at the county health rankings data and you're looking at your county snapshot, what I would suggest, and Carla mentioned this when she sort of walked through a snapshot, is to click on areas to explore and areas of strength. It'll highlight some key measures that are, as she mentioned, either doing really well or maybe could use a second look. And finding one that maybe is an area to explore could be a good way to ease into some of the challenges that are happening in your community. So pick one that highlights that color. And really dig in. If there's data disaggregation, find out how it's affecting different racial and ethnic groups, or click on the measure itself, as I mentioned before, and learn more about what the measure is actually telling us. And you'll also find policies and programs that are affiliated with that measure. So policies and programs in What Works for Health that can help address that specific measure. So that might be a good way to wade through a lot of data and really get started. But I am seeing that we are low on time, so I'm going to send it back to Carla for just a few closing words.
Thanks, Lindsay, and thanks for all the questions and comments. We appreciate that. So our hope is that you've learned some information that can help you use data to address economic inequality. Please let us know how we did. Raquel is chatting a link to a brief feedback survey. Please open the survey so you can complete it later. And before we go, we wanted to share with you a few additional opportunities to learn with and from your peers and national experts. First, Prosperity Now has launched their COVID-19 New Crisis Same Story video series. Each video will highlight grassroots and community innovations that have been developed and piloted to address the challenges of racial economic inequality. Tomorrow's episode will be on issues around health. So visit prosperitynow.org to watch the episode tomorrow. Next, we invite you to join County Health Rankings throughout the summer for a special webinar series on strategies for COVID-19 response and recovery. We'll be highlighting the challenges communities are facing as they respond to COVID-19. Each webinar will be followed by a 1-hour discussion group opportunity. In the discussion, you can learn from and connect with lead researchers, policymakers, and each other. Collectively, we'll identify strategies and solutions to help build a more inclusive, equitable recovery. And I want to give our June 25th webinar a brief plug. It will be facilitated by our own Attica Scott and will feature 3 amazing health champions, including Dr. Cameron Jones, who will be discussing the disproportionate impact of COVID-19 on Black communities. Join us for one or all of these webinars and make sure you mark your calendars so you don't miss out. And we have a discussion group scheduled right after this webinar. Joanne Lee with Healthy Places by Design will facilitate the discussion. In fact, Joanne is in the audience right now and would like to know what you want to learn more about. I'm asking James Salancha Poll. Please share what you would like to dig into a little more during our time together after the webinar. So the poll, what do you want to learn, share more about? I want to learn about the links between health and wealth. I want to learn more about using data to drive change. I want to learn about strategies to address economic inequality. And I want to share what my community is doing to address economic inequality. You can pick all that apply. And in a minute, Raquel will place the discussion room link in the chat. So we really want you to go ahead and click that link and come on over to the discussion group to talk more about these issues.
So we'll leave this poll up for another few seconds, but it looks like we're getting a lot of folks really interested in learning more about using data, and a lot of folks looking for more strategies to address economic inequality. So I know those will be 2 topics that Joanne will definitely make sure that we touch on during the discussion group. And there's also a fair number who want to learn more about the links between health and wealth. So that's a great topic, and I look forward to joining the discussion group with others to learn more. So we can close the poll. Thanks for everyone who participated.
Thank you, and thank you, Lindsay. And you can also share your input with us anytime via the Contact Us form on our website. A resource guide is available online accompanying this webinar. Thank you so much, and we look forward to seeing you in the discussion group.